Leapfrog has really capitalized on the commitment and power of large purchasers to drive quality in a meaningful way, as we've just heard. I run a small company, fewer than 300 employees. We're price takers in the health insurance world, in the health business. We don't have anyone devoted to healthcare, and a 300-person company should not. We're barely good enough at game shows, frankly. And of course, my connection to healthcare was a single magazine article. Didn't exactly make me an expert. But when I met with Leah, she explained to me that while it was true that Leapfrog was built on the shoulders of large purchasers, committed to improving our healthcare system, over time, increasingly there's a realization, there's a limit to how much even the best intentioned large intermediaries could do, how much impact they could have on quality. Leapfrog understands that over time, the primary user of the data that Leapfrog produces is likely to be consumers, individual consumers. And I suspect that the next frontier for all of us in healthcare is going to be the expression of that consumer power. Now, I got to emphasize, this isn't because of change in government policy. It's not because of the new legislation. In fact, it goes in exactly the opposite direction. There were many of us who argued that maybe after 50 years, we should learn that disaggregated forces might have more disciplinary effect than large intermediaries. But that's not what policymakers have decided. My point is what they've decided is irrelevant. Because with all the debate we have over whether healthcare providers should be required to be transparent, we've forgotten something that every other industry has found out, which is every confidential act, every confidential relationship is between two parties. And one of those parties is the patients. And so we may not be forcing institutions to be transparent, but the patients have the ability to create the TripAdvisor in healthcare. And it's coming. Roughly 60% of Americans who were online in October visited a health website during that month. 60%. 127 million Americans went to a health website in October. Now, most went for information on a specific condition or treatment alternatives. Roughly 20 million go to a WebMD or one of the sites operated by Everyday Health, such as Mayo Clinic. But 10 million went to healthgrades.com for ratings of doctors and hospitals, 10 million. And a growing number went to condition-specific message boards on social networks to talk about specific doctors, specific hospitals. Healthcare has been insulated to date from the true transformation we've seen online communication among customers bring to other industries. The average age of the customer in healthcare is a bit older. The conditions are serious. Some are just unable to think about being online. There have been privacy concerns, maybe even traditional deference. The complexity of subject matter limits it. But that can't continue. It's starting to catch up. And it will be a tidal wave. Because of the article I wrote, I hear all the time from entrepreneurs and venture capitalists looking to fund the TripAdvisor of healthcare. I can't tell you how many people wrote me about their own personal experiences with the type of detail and information that I wouldn't share. And anybody thinking that people are going to keep their experiences private has not spent much time on Facebook lately. There's a lot of discussion in healthcare, among healthcare experts, about professional culture, institutional culture, and how these are barriers to the type of change that those in this room are committed to achieving. There's no question that that barrier exists. And there are a lot of questions about how do you transform culture? Most of those tend to be about institutions. How does an institution transform culture? How does a regulator transform culture? How does a government transform culture? Again, my suspicion is that's irrelevant. You transform culture in great part because of a lack of alternative. And the flood of consumer accountability that I suspect we'll see over the next decade will create that lack of alternative. There will be no place to hide. Leapfrog is an important part of that because Leapfrog has promoted an important mechanic, measurement, standards, things that we can actually use to evaluate. At the end of the day, changing the culture, responding to a new transparency, is our best hope to improving safety, outcomes, quality, even comfort and